Can nutrition affect your health, especially your oral health? Well, if you know anything about Dr. Claire Stagg, you know everything is connected. So we are very fortunate today that we are going to be learning from, what is it, the mouth whisperer, the body whisperer. We're going to be able to call her so many different things because it's all connected. So today we're going to be talking with my favorite dentist, and like I said, mouth whisperer, Dr. Claire Stagg. She's going to be talking to us about how nutrition will affect our oral health. So make sure you take lots of notes today. Get your pencils, your pens, your paper, because we're going to learn and grow together. And when you need a friend, you can count on me. I'll be right here waiting for you. Hi, my name is Lily McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show, Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, my question to you is this: have you gotten your book yet? Smile.
Yeah.
It's all connected because Dr. Claire Stagg has been in the classroom for probably 8 to 9 months now, and she's been sharing all about how we're connected. This is going to be a little break after this class. She's going to be taking a little break because she is preparing a course that others will be able to, functional doctors and other dentists, to learn from Dr. Stagg so they too can be certified under all the information that she's learned. So I'm really excited to talk about nutrition when it comes to our oral health. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Claire Stagg is here to do just that. Welcome back to the classroom, Dr. Stagg.
Thank you, sweetie. Thank you. It's such a pleasure being with you as usual.
Yes. And I'm excited that, we've talked about so much. And one of the topics today is in this book. Every single one of the topics that we've had is in this wonderful book. And I want to encourage all of you to click the link, get it below, or you can, she'll take you to Dr. Stagg's or Amazon, and make sure that when you do read the book that you write a review. And so today, Dr. Stagg, we're talking about health and wellness when it comes to nutrition and oral health. So take it away.
All right. Well, thank you. I'm very honored that I have the floor. Um, just a little segue for those who have not yet been on board, so to speak, is that the body is all connected. And in the book, I created 6 connections. And I divided the book past, present, and future. And then the present, I brought in the clinical with the admin. Now, the clinical part is where you have the flower, the 6 connections, and we tie in the body structurally, chemically, mechanically, functionally, emotionally, spiritually. What I would like to do today, and I have to tell you, I was like so amazed by, because this is what I'm going to be elaborating on today, is the chemical chapter. It's literally chapter 15, nutrition's role in oral chemistry. I was like, oh my God, this is so cool. This is so cool. This is so cool. Because it took me, 14 years to put it all together and have it printed, etc. But I mean, putting it back, it's like, damn, this is well written.
If I do say so myself, because
if I do, yes. I mean, I'm just like flabbergasted. And the beautiful thing is, for those who may be overwhelmed or are taken aback by its size, it's literally a bedside encyclopedia slash reference manual. You can have it anytime, any place. You can flip it open, because that's what I did. I said, okay, Lily asked me, let's discuss nutrition. Well, we've talked about Western Price is in there. We talked about different ways, but let's tie it in all together. And I know we only have about 50 minutes to do this. So what I did is I made notes, my notes of my book, And so I'm going to basically break it down and I'll tie in different things that we'll talk in about the clinical aspects. I'm going to interject that things that I've had with experience and patient care, etc. But basically, when we go ahead and we discuss this, we're talking about, well, thank you. So what do you go ahead and do you have nutrition? What's nutrition? It's either what you eat or what you ingest, all right, that helps your body grow. Think of the body as the bricks, and everything that we do could be the mortar that you put around the bricks, right? So there are going to be compounds that you get in food. Obviously, you have the fiber and you have all the other things that you'll get, the solubles, the hard foods, etc., proteins, fats, lipids, etc. But what we'll do is we're going to break it down and how they correlate to the mouth per se, with the pros, the cons, etc. And I'm sure you're going to have lots of questions as we go along, Lily, so we'll add them. All right. So basically, we'll talk about vitamins because that's a multi-billion-dollar industry of vitamins. People always say, oh, I'm taking supplements, I'm taking vitamins. Why do you need to go ahead and take any supplementation or any vitamins per se? All right. Vitamins are organic compounds that your body doesn't produce on its own. Okay. So if you go ahead and you think about it, be it 100 or more years ago, the body used to be able to create its own compounds within the foods that we were able to pick and grow in our backyards or on the farms or hunt and gather, correct? Unfortunately, with the advent of processed foods and hyper processed foods and everything that's white sugar and white flour and white everything, the nutrition of our soils, the nutritional value that's rendered through our foods from the soils are totally depleted. And add to that all the chemical compounds that are added to the water, our body just can't handle it anymore. It doesn't process things the way that it should. It can't function the way it could. And we end up having a lot of diseases or a lot of dysfunctions. So I kind of broke it down into the things that we do that we can get the most benefit from. All right. So you'll have, let's say, vitamins. You will have the types of vitamins. You either have fat soluble vitamins or you have water soluble vitamins. Fat soluble vitamins are the ones that are going to accumulate inside your liver, and you need the bile to be able to solubilize them, so to speak. But there are also the ones that you need to go ahead and to make sure that if you eat or drink too much of them, you can have a toxic level. All right. The water soluble ones are the ones that if you don't use them, you just pee them out, so to speak. They'll be thrown out in the water in your urine. All right. So again, remember, a vitamin or supplement is something that you cannot produce in your body. So this is where it's ready. Think about this. If you cannot produce it naturally in your body, just think a little bit what level of quality the supplement that you're purchasing needs to be able to meet the standard that your body can absorb it. It's very important. Otherwise, you're spending a lot of money for nothing. Those are now everything's in the book. I couldn't say certain things in the book because I wanted it to be as apolitical as possible. And I'm not being political here either. However, here I can probably say on this platform things that I may not have been able to say in the book. So I'm just letting it all go now, right? Okay.
We
All
only
right. So now
expect that from you. We only expect that from you. So keep going, keep going.
I'll keep going. All right. So a couple of vitamins that we'll talk about are A, D, E, and K. All right, the fat ones, beta carotenes. So vitamin A is one of those that is very influential in embryo formation. There was a study at Salk Institute that showed that the body is symmetrical on the outside, but asymmetrical on the inside. You'll only have one heart, you'll only have one liver, you'll only have one stomach, etc. Right? So that's very important. The vitamin A's that you will absorb. All right. Vitamin D, very important. Remember during COVID, they wouldn't let people go outside. All right. Well, that was one of the things that is super helpful for health is the vitamin D. It also helps with the transference of other hormones. It also is activated. The sunlight helps activate and create the vitamin D, and there's different types of vitamin Ds, and different people need different levels of D. It is one that is also very important for sleep. All right. Okay, so sunlight, activated by sunlight. It also, if you didn't know, is very important with MS. Patients who have MS with the plaques in their head. Vitamin E, you can go ahead and get obviously with a lot of nuts and foods. Be careful of the oils because that can make a very high level of fat. And then vitamin K. So one of the things that you need to be careful of as vitamin K in dentistry is that we want to make sure that we don't have bleeders. So that's where too, if I have a patient that's on anticoagulants, or I have a patient that's actually on certain medication and I'm doing extraction care, I need to make sure that I know which medications will be anticoagulants and or what their prothrombin times are, their PT times, and or how often or how much they bleed. Same thing for vitamin C, by the way. When I do long procedures, I always tell patients I have a little list of things. Be careful what you eat or drink before you come in. Obviously, coffee, juice will make you want to go urinate more because they're diuretics. But vitamin C, actually a little pearl for everybody, vitamin C will help negate the value of anesthesia because your body will wash it out quicker and faster. So if we numb you up, you might need more shots than the average person because you had a lot of vitamin C. So I'll tell patients, unless there's an issue, check with your physician to see what you can reduce a couple of days ahead of time. But vitamin C, if it's something that you take on your own, then go ahead and just back off a little bit. Same thing with aspirin, unless it's something that's specifically recommended by a physician. That's something you might want to be aware of. All the herbs and all the things that people take for granted. You know, you take for granted, why take herbs? Oh, yeah, you might have some that create a lot more of vasodilation that will make you bleed more and or make your blood more liquid, you know, or will help you to make it go through your vessels faster. So again, it's all connected. You can't really separate one from the other. Just be aware of what you ingest. All right. So
Can I ask you a question about vitamin
yes,
C? Because
yes.
I take vitamin C in high doses. And when I had my explantation surgery, they wanted me to do antibiotics. And the doctor wanted to do it. And after the doctor left, I told the nurse that I was not going to do I was not going to do the antibiotics, that instead I would use vitamin C. And I know that vitamin C can be used as an antibiotic as well. Is that another reason why you like people to do the vitamin C?
Um, that I think you need ethically, I cannot tell you that it would be a medical procedure. I
Okay.
cannot get in the way between a physician and their patient.
Mhm.
I think there may be other things that could be more herbally conducive as antibacterials.
Mhm.
I do not think, and I may be wrong, I do not think that vitamin C would be no named or seen as an antibacterial.
Okay, well, it was more like a antibiotic. Is an antibiotic an antibacterial?
Well,
Is it?
antibiotic would be against any organisms. So you can
Yeah,
have viruses, you could have different things.
yeah.
Antibiotics will not work against viruses, for example, but it all depends. Again, ethically, if you have infection, you need something that will take care of the bacteria or the
Okay,
microorganisms that are attacking the body.
okay,
So,
okay. Good.
vitamin C actually will help you create more collagen, will help you heal better. Vitamin C will help you be more immune resistant to certain things because it's many different things. You jumped. We're not there yet because that's a water soluble one. All right. But vitamin C, for example, is important for collagen. It's important for sleeping too. And it is also very important for scurvy, for example, in the mouth. When they came over the ship, they were a lot of people would have their teeth coming out, periodontal disease, because they didn't have vitamin C. That's why they took care of that with lemons, for example, citrus and things like that. So to answer your question, I don't think you would have to double check with your physician, but as a dentist, I cannot tell you take vitamin C as an antibiotic. I
Well,
cannot
you
tell you
had
that. No.
mentioned vitamin C to help with for the process of the anesthesia to leave your body. That's why I mentioned vitamin C. So
You're
good to,
right, but you're talking about one thing, I'm talking about
yeah.
another.
No, good.
When I put anesthesia somewhere, I want the anesthesia to stay there so the patient will stay numb.
Mm-hmm.
What it does is it helps it flush things out.
Flush it out. Okay,
So
good.
if you want the anesthesia to be flushed out, maybe that is a good thing with a lot of water to get the anesthesia
So
out, possibly.
after the procedure, you're saying take the vitamin C.
I do not, well, it'll make you bleed also.
Oh,
So that's what I'm trying to tell you. When
okay.
I have a patient that's coming in for surgery that I want to get numb and I want the anesthesia to stay there longer, I tell them to avoid vitamin C a
Got
couple
it.
days before the procedure, and then they could resume it afterwards.
Got it. Okay. Now I get
Totally,
it.
totally different concept and than what you were trying
Yeah.
to say. Make
Got
sense
it.
now?
Yep. Keep going.
All right. Okay, so that vitamin C then very important for immune resistance and building up of collagen and creating a healthy body. It's very important for the formation of the teeth also and the periodontal tissues, which are the tissues around the teeth, which would be obviously the bone as well as the gums, the mucous membranes and everything, right? Okay, now let's go ahead and let's talk about vitamin B's. All right, B's are very good for hair. B's are very good for general health. And usually you'll find that B's would be more of a bio complex, the B complex. All right. What you want to be aware of when our field is that some vitamin B's can react with certain drugs. So, for example, certain antibiotics will be affected by vitamin B. Vitamin B, for example, tetracycline, which is one that if you're not careful when it's given to a child that still has not yet had all their permanent teeth, the tetracycline actually will have a gray tinge to the teeth, will create a gray tinge to the teeth as they're formed. It's called tetracycline staining. So be aware that some antibiotics can be affected by vitamin B's and vice versa, or let's say the interaction of the tetracyclines or antibiotics will be affected and vice versa. The other thing too is for those of you who are having procedures with nitrous oxide, all right, the nitrous oxide, the gas, the funny gas, the gas that makes you laugh, laughing gas, there you go. It actually negates the effect of vitamin B12. All right. And this is a really good one for those of you who didn't know. A lot of people who are vegetarians get shots of B12, but actually B12 is created. You don't get B12, but B12 goes through a process. It's like a tumbleweed that starts in the mouth. It's the saliva compounds that add to this, that add to this, that add to this, that add to this, that eventually create the B12. I thought that fascinating. I
Yeah.
like the tumbleweed analogy too, by
No,
the
I
way.
like it. I like it. I didn't know that about the B
Right.
vitamins.
And
Yeah.
then the other waterable soluble vitamins will be the P's, which will be tied in with the P as in Patrick. P's will be tied in with the bioflavonoids that are very highly linked with the B's, as in, as in the C's, as in Claire. All right. And then obviously you also have CoQ10. Lots of notes. I hope you're prepared. All right. Anything you want to ask me about vitamins? And I'll move on to minerals
Yes.
next.
You had mentioned vitamin K. Now, when
No,
you hear about vitamin K,
yes,
when you said
K is a fat soluble one.
yes, but when you mentioned vitamin K, there's K2. Is that the same thing as vitamin K?
There's K2s, there's each one has different numbers. It doesn't matter. Each
So
one has its own properties.
any
It's like
K?
you, uh,
Because you had mentioned vitamin K being
right.
important. And
Right.
so I was wondering if that was does it matter what, if it's K2
Yes,
or,
it does. Just
okay.
like D2, D3, etc. Their variations will be in their dosages
Uh-huh.
and their pathways that they could be more effective. So
Okay.
yes, but K is very important. Like if you eat a lot of greens, kale and things of that nature, be very careful because they'll affect your bleeding time.
Okay. Perfect. Okay.
Okay?
Carry
All
on.
right, so moving on. We're moving on now. We did that. We're going to do minerals. Minerals are really cool. And in dentistry, we have a lot of minerals to deal with. All right. Did you know that the enamel is formed by the hydroxyapatite crystal? All right. So that's very important. Think of it like a hexagonal. And what it does is that the hexagonal, they adhere to each other. That's how I was quote unquote sold on the fluoride use way back when, 30, 40 years ago, is I was told that each hydroxyapatite crystal had hydrogen at the corners, right? And because fluoride was a lot more negative than the hydrogen, it kicked the hydrogen off, and then the fluoride incorporated it and it added like a mortar to the brick. Well, lo and behold, we know a lot more now, the nociferous toxicity of fluoride. All right. So just be aware that you have other alternatives to create stronger hydroxyapatite minerals. And some of them are actually, we have in our office, and there are other brands out there that actually have pastes that have hydroxyapatite minerals that help create stronger minerals on your teeth. So that's a really great adjunct to be aware of. Okay. One of the ones that I want to spend a lot of time, well, a lot, one that I really want to emphasize on is iodine. I remember being at a conference when there was a doctor who always knew when one of his daughters was pregnant, because he'd ask her, she would ask him for a prescription for higher dosages of iodine. So what does iodine do? It actually feeds the brain. It gives a higher IQ. It also feeds the thyroid, which is why when you have thyroid issues, say no chlorides, no fluorides. All right. So there's a big correlation between thyroid, iodine, fluoride, and chloride. Okay. So that's where too, unfortunately, they put a lot of chlorine in the water too, right? To make it cleaner. So the thyroid is very important. The other thing too, and I'm tying back in what I do, those of you who have sleep apnea, remember one of the comorbidities that basically this was a really great session to end with, Lily, because we're tying in all the things we talked about the entire past few months. So when you have sleep apnea, one of the comorbidities, remember we talked about cardiovascular diseases, we talked about hypertension, propensity for strokes, ADHD, polycystic ovarian syndrome, and that's where iodine is very helpful. So a lot of the hypothyroidism, polycystic ovarian syndrome, and that's where the vitamin D comes in. So you see, you got them all. It's all, think of it's like we have a big discotheque, a big party going on, and everybody plays their role, but they all dance together to have a really good rhythm. And they work synergistically. Now, sometimes they will work antagonistically, which means against each other, but in a certain different way. And that's where when you're mentioning dosages, that's where I have to take my hat off to the big pharma docs, because the allopathic docs, I mean, a really good doc will have to learn how this one counteracts this one, how this one then acts or synergizes this one. And if you take this, you're going to have a side effect of that. So that to me scares the crap out of me, right? That's why it's better to have a nice, healthy, non-processed diet to where you hopefully you're giving your body the fuel that it needs to be able to function appropriately, right? those of the patients who do not get proper iodine will have low IQ levels, and actually even to the point there's cretinism. So cretinism is when they're actually, now it's pejorative, but with people who don't know what a cretin is, people would think that they're stupid, so to speak, but it actually is a disorder or a dysfunction of the level of IQ because they have a very low IQ. All right. And ADHD. All right. Now, remember we talked about airway and we talked about sleep, and now we talked about all these supplements, and it's the thyroid and all the supplements that help with the thyroid and all those that help with the airway. See? So those are the things that I look at when I have a patient that comes in. I say, okay, how do you feel? What are you eating? What's your diet like? What supplements do you know? Remember, you filled out the forms. You said, oh my God, so many forms. But did I not look at your diet? Did not look at your supplements? Because then I need to know how they work together, because
Mhm.
I now have to also learn the big pharma stuff to know how things work, right?
Yes.
I'm going to give you a really good little thing, and I don't know if I wrote it in the book, but I think I did. In the olden days, and I think it still carries on in the Amazon, you would have you would have a sentinel in every village, and the villages were not further away. The shaman was not further away than a day's run. So that if somebody was sick in the village, you had a courier that could run, an Indian, Aborigine or Indian in the Amazon, would run from his village to another to the shaman, get what was needed after he told them all the symptoms, and be able to run back to save that person's lives. Isn't
Mm.
that amazing?
Yes,
That
amazing.
is
What's
great.
amazing is to run somewhere and still remember the list because they probably didn't have paper and pencil, maybe just the
No, but
snow smoke
they
signals.
didn't have all the
Better
chemistry to
memory.
blow our brains off,
Yeah.
right?
Yeah,
Yeah,
we have so many tools to kind of make us like dumber, like the
lazy.
calculator, the computer. Now we have AI. We don't even have to think about anything. It used to be we had to look things up.
Remember your phone number when you were a kid? You still remember that?
Yeah. Yeah.
Yeah. All right. Okay, so moving on to iron. Iron is a big one too. Obviously, you have to be careful because if you have too much iron, you could have issues. I have a few patients who have too much of it, and they say that the only way you can get rid of that is to have a blood drawn. All right. Calcium, phosphorus, magnesium. Oh my gosh, magnesium is so important for muscles and for sleep, as well as for muscle tension. And a lot of my TMJ patients who are lacking magnesium could end up having major muscle cramps, and that could be a very big deterrent for the stability and the ease of the jaw joints, the temporomandibular jaws, right?
Hmm.
Joints. Okay. One of the things that I want to come up with, and I don't think we've ever talked about this on in our podcast together, is the concept of epigenetics with nutrition. Have we done? I don't think we've done that. So,
No, I don't think we have, but I do it all the time in the show. I've had Dr. Bruce Lipton. We've had other teachers. I talk about epigenetics all the time,
all
or a
right,
lot. Yeah, but
let
go
me
ahead and
talk
tell
to you
us what
about
you want to say.
right. So about teeth. So basically, for those of you who I haven't had the opportunity to speak to, epi means over the gene. All right. And so basically, there was a study in 1980, in the Swedish study, that went ahead and showed the correlation with the genetics, or the way that these children were formed, going back generations and generations, and figuring out when these patients or these people were actually either in a famine or in times of plenty. So what happened is this totally negates the concept of Darwin, who said that it would take millions of years and it was generational to go ahead and to have the genes mutate. But that's exactly what Weston Price did. Remember, he
Hmm.
would have in his book, Nutrition and Physical Degeneration, he would have, you have in the same family, the same generation, one sibling that would go into the village with a white man and his white sugar and his processed foods. And then you had in the same family, one sibling who'd stay in the village and eat the normal indigenous foods. And he did this in about 6 tribes around the world. So it wasn't like it was one place that this only happened. And he showed that the genetic mutation, the way that the individuals grew, again, mutations in the way that the arches developed, the way that the mouth developed, the amount of teeth that could grow, and the room for the teeth to grow in, the way that they could breathe or not breathe, the allergies, the asthma, all the different things that have to do with my wheelhouse. Remember, Weston Price was a dentist, right? So he was a prime example to show also the epigenetic concept. So that was really, really cool to go ahead and to do. To understand with the industrial age, everything is going faster. The mutations are going faster. You know, it used to be that just a generation or two ago, you could have all 32 teeth. Now people are taking teeth out to make room, which are actually creating apneic patients. All right.
I learned that in your book that and also because of the people ahead of you that researched it and all, but you know that the less chewing we do, the softer the food becomes, the less our jaw is developed.
Correct.
And he has the before and after pictures of, you know, before processed foods and after processed foods. Not even a generation went by where it's just like just completely changed the bite of a
Right.
person. Yeah.
Right. And that's what Weston Price did with his children, with his siblings in his book, to where literally nutrition and physical degeneration, it was the same exact generation, two sisters.
Hmm.
One went and
They did
one
it with
stayed home.
twins. They did it with twins too, right? Like,
Yeah.
yeah.
Yeah. So, and then the other one who did it with twins, and that's, I'm glad you brought that up, was Dr. John Mew. He
Okay.
created the BioBlock, and that had a massive controversy in Britain. But I mean, the man has his science down pat. He showed that if you don't breathe through your nose, so I mean, Harvard did massive research too, where they clogged the nose of a monkey, rhesus monkey, and the monkey went ahead and breathed through his mouth. So the whole facial physiognomy was totally deformed. Well, Dr. John Mew, same thing with his BioBlock, showed they did one twin with arch expansion and one twin with extractions. It was really sad to see the difference where, I mean, one looked really, really sad. The other one looked beautiful. So, I mean, that's really good. So remember, disease needs a host environment as well as the immune system and home care. And that's where, too, we were talking earlier on about the immune system, to where all the vitamins and the proper supplementation, the proper nutrition, all that would be very important to go ahead and to create not only the host, but also the immune system to the resistance. Vive la résistance, right? All right. Now, just FYI, there is a dental code for nutritional counseling. Woo-hoo, we have one. So we actually can teach you how, I mean, a lot of times, unfortunately, dentists don't have time in their practices to go over what to eat, what not to eat. Yeah. So that's a big thing to go ahead. And that's where Weston Price and Standard Process, they were both dentists. That's in part one of the book, where I introduced them as mentors and leaders in their field, where they really took on nutrition big time, big time. Weston Price carries on his life. His life is lived on with the Price Pottinger Institute. And then Dr. Royals, the legacy lives on with Standard Process. Okay, so I wanted to bring a little fact up, and if I'm talking too much, you need to let me know. But one of the things that's really important, and people don't realize that they're different in the book, there's a big category on headaches that influenced by lack of certain nutritional adjuncts. So you could have a headache that will be due to lack of iron, headache that will be due to lack of a certain vitamin, headache that'll be due to lack of certain things. And it's very, that was a Standard Process feedback that was passed on to me that I was able to share. All right, couple more things that I'm going to very briefly touch that are dear to my heart. And there's supplements. Well, we can talk about cloves and things that we actually are chemistry or nutritionally compounds that we use in the dental practice. One of them, you'll go to a dental practice as a herb. You ever go into dental practice and it smells of cloves?
Yes.
That's a typical dental practice smell, right? Now, in our practice, we have a green building and it's ergonomically designed so that the filtration is very precise. The air given into the building is very clean. And so we don't do root canals either. At least I don't do them. I will refer them. I do therapy with doctors who do root canal therapy. I'll ozonate the canals for those patients who do want to keep their teeth. There's always the pendulum swing on options. I'm very big on options. I don't think one should be cut dry. And God knows I do that a lot in my life. It's either yes or it's no. But sometimes when it comes to healthcare, it's not a cookie cutter thing. And you have to respect that everybody's different. And therefore, you have to have as many arrows in your quiver so that if you come in, Lily may want one thing and her body constitution may require that one thing. Tom, Dick, or Harry may be totally built differently and they will require different things, or they may want different things, or they may be emotionally ready for other things, or they may be financially only capable of certain things. So that's why I think, and this is where I would like, as we talked about teaching doctors, my goal is to bring all of this back so that the doctors have as many arrows in their quiver so that they can give the patients the option. So it's proper care. It's not sick care anymore. It's well care. All right. When it comes to herbs, you have the different types of herbal medicine that you were probably used to. You've heard of Chinese herbal medicine, all right, that is eons old, thousands and thousands of years. You have a Ayurvedic, so that's more of the Indian continent, if you will. Then you have the Western herbal medicine that comes back way back from Greece and Rome that was carried west from through Europe back to us. And then you have the Arab continent that had a massive influx in herbs also. All right. A couple of herbs that we have to be cognizant of. I talked about obviously the eugenol. We use in our practice, we do use some mint when we're trying to get patients to actually breathe better, when we're doing our pharyngometer test to check the volumetric changes of when we take a special bite to open up the airways when we're doing sleep appliance therapy. For those of you who are not familiar, aspirin was actually created from a tree called the willow bark. It's from the bark of the willow tree. Ephedra, a lot of those people who are on medication for asthma and things of that nature, epinephrine, one of the things that we use in our injections is actually taken from ephedra. It's a sympathetic mimetic, so it means it closes the tube, it closes the vessel so that you don't bleed as much. We don't usually use that when we do extractions now, for example, you see? So that's where you have to be cognizant of that. And the biggie, where I think I'm going to end and I'm going to let you take over, is xylitol. So xylitol is a big, big, big alternative to fluoride, which I think is now starting to collapse as the masses are becoming more and more aware of its origin and its toxicity and the way that it was actually imposed on people without their knowledge and without their consent, because I'm sure if they knew exactly what it was, they would not approve of it. And that's what's happening more and more. Utah is the first state that's actually going to have a state ban. I know here in Florida, we're working on it. And so
I thought it was approved in Melbourne. I thought it was, no,
it has
Palm Bay,
been.
Palm Bay.
Yeah.
Yeah.
Palm Bay, Titusville, Melbourne, and there's slowly but surely other cities. Trust me, that approval went at 1:15 Wednesday morning. Yeah, I was there till the very end. Ooh,
Awesome.
so that
Good for
was really
you.
good. Yeah, and so xylitol can be created from corn or from the birch tree. And again, non-GMO, GMO, you have to be careful.
Mhm.
But I think, in effect, what's happening is that the more and more that people are aware and cognizant of what's out there, the more you eat healthily or the more food you can get organic. Remember, too, a lot of the people that spray, the ones that created all the toxic chemicals to kill the weeds, are actually the weeds that help heal you are actually the ones that create the meds that you're supposed to take because they can't get the natural food. So it's like a vicious circle, and you end up having things that you can't eat to help yourself heal, and then you put on drugs that have counter effects. Yeah, cascade
Yeah.
effects. So yeah, I ranted today, did I not?
No, 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 this is great. This is great information that you will find at Smile. It's all connected. I want to
Yeah.
encourage all of you to get your copy. Go to Amazon.com. You can go to the link below in the description. All you have to do is press it. It'll take you to her book and you can buy it. And you can have this just to like pick up and like if you want to start educating yourself, just pick it up and read a little bit and each time look at the topics and say, is this speaking to me? But it's called Smile. It's all connected. And you can also, we can talk about Dr. Claire Stagg. You can go to healthconnectionsdentistry.com. Also, Claire Stagg, you can find her at 321-777-2797. And so I want to encourage you to check out all the classes that we've done together. You can find
Mm.
them in YouTube and just make sure that when you go to whenyouneedafriend.com, like to check out today's conversation, or another conversation. They're all the audios for every single class I've ever done since 2011. They're all in the website. You can just listen to them even when they're not in YouTube anymore because they've removed 83 videos in the last 2 years because this information is being suppressed. So go to whenyouneedafriend.com. Once you get there, please subscribe to the website. Like and follow me on all social media. That way you know what's going on in the classroom, even if they try to change and kind of hide me from you. Go check out my sponsors, support my sponsors the way that they're supporting the classroom, and check out my Shop Now bag, all Lily approved products, and from head to toe. You can check out also the classes and workshops. We're going to be doing the neurofeedback um, rewriting the brain with neurofeedback training. That's going to be soon. So check it out. Get your pass at $20 discount. Go check that out. And also check out, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, a one-time donation. Let's work together to help the classroom grow. Whether it's your time, your talent, your treasure, it's all very special to us. So please be a part of this journey with me, and I'll be a part of this journey with you. And I'm totally grateful that Dr. Claire Stagg is a part of the journey with me and the journey with us. Once again, I just want to show her book. It's a beautiful book. I know it's big, but let me tell you, the font is perfect size. It's a perfect size. You can see it from across the room. And as we get older, we want to be able to have that flexibility. So it's
And
thank you so much.
vitamins are good for the eyes too. You can,
Yes.
so
Yes. And so thank you, Dr. Claire, for everything that you're doing. And I have loved having you in the classroom. It's been nice to have you not only share your information, but mostly to get to know you better as a friend. So I'm just really grateful. And I'm looking forward to other classes that we're going to do in the future, but coming on a monthly basis for those of you who will be going, where's Dr. Claire? Where's Dr. Claire? I'll say that she is now getting ready to educate other doctors so that all of you can have this information with your doctors. And I'm
right.
hoping to be a part of that as well, Dr. Stagg. Okay,
Mhm.
so any other things, because, we've got, about 10 minutes left in the classroom here. So what are other things that are very important that you would like to touch upon?
So we talked about Weston Price.
Mhm.
What I appreciate a lot about him is that he was able to blend in a lot of the nutrition. I mean, the man was a genius in his own right. He was actually an orthodontist, so he had that background. He became the president of the American Dental Association, so he was pretty out there. what I find fascinating is that he was able to go ahead and do research, and that's where the focal cause of infection, that's where the big no-no about all the biological dentists are in arms about not doing root canals. So for those of you who are not familiar with that, because everybody freaks out, is that they showed that if they took the extracted a root tooth from a person, for example, who had heart disease, and they put it on the skin of a rabbit, that rabbit will develop the same diseases that the person had. And remember, I talked earlier on about ozone gas, to where you have the pendulum swing, to where you could take it out. There's nothing else you can do, take the
Yes.
tooth out,
Hmm.
all the way to allopathic, let's do the root canal. Well, there is a fine in between, the pendulum will swing which either way. You can go ahead and have the root canal treatment done with ozone therapy. So have it done. Then I fumigate the canals with ozone, and then they're filled. Now I found out from the doctors that I referred to that the lasers that they're using are now going to have ozone incorporated into them. So I'm
Wow.
really
Wow.
thrilled to hear that. So there's that.
So
Western Price.
what if somebody has already had root canal, doesn't want to remove it? Can they do a treatment to save
The
the root canal?
so the best way to do it would be to retreat it. So obviously have somebody, now the technology nowadays is like phenomenal compared to where it was
Hmm.
20, 30, sheesh, even last month, right?
Yeah.
But what it's going so fast. What you can do is you can have them use a 3D cone beam or a CT scan, and the pixelation would be so fine that you could actually see if there are little canals that were missed, and those are usually the ones that will cause problems down the road.
I want to
So
check out my cone beam that you did on me because I'd like to see what the condition of, because I do have a root canal and I'd love to
now
see the
my
condition of it.
right, but my cone beam, because of what my field of view is, it's a double field of view because I work with the head and the neck.
Hmm.
The endodontist will only have that specific area. So they're going to be super concentrated on the diagnostics for the few teeth. Me, I'm looking at the whole head and neck, the airway, the jaw joints, everything.
Got
Now,
it.
mind you, my oromaxillofacial radiologist will tell me there's something going on and give me feedback. But if you want a lot more detail, an endodontist would be the route to go.
Okay. Okay.
If I can continue with Western
Yes.
Price.
Keep going.
All right. So Weston Price, we talked about nutrition, where he went off around the world and he did the analogies with the siblings. We talked about the food, etc. But one of the things you need to understand also is he was very big on airways, because obviously when he saw that nutrition actually changed the way that people were formed and how they were, developed, he went ahead and did arch expansion. Remember, he was an orthodontist, and one of the most leading studies that he did, or articles that he wrote, was about the young man who had trisomy 21 or Down syndrome, who had a very low IQ, who had sleep apnea. Now, remember, one of the things with Down syndrome is their tongues seem to be larger than their mouths, but actually it's their mouths that are too small for the size of their tongue. All right. So when they did arch expansion, the tongue was able to have a lot more room, therefore it didn't collapse in the back of their throat. Now, watch this. What's the top of the roof of the mouth? It's the nose, right? Well, if you think about it, right above the nose, you go all the way to the base of the cranium, and that's the sphenoid bone. Well, that's the base of the cranium. That's what the whole the two hemispheres just sit right there. So when you go ahead and you affect that, by that arch development, you affect all the way to the sphenoid, which is the base of the cranium, which houses the pituitary gland, which secretes hormones. The young man then was able to grow. He grew several inches. He grew pubic hairs. His IQ levels were higher, and his sleep apnea indices reduced. All of this to where he now became a much more functional participant in his family life, and was actually able to go down the street and buy things at the shop or whatever. So, I mean, that in itself is to show you how much arch expansion can do, airway development can do. IQ can develop. And one thing Brittany said, remember to talk about milk. So it's the same thing. If you go ahead and you have an environment or food that causes the adenoids or the tonsils to swell, you're not going to have an airway. So always remember airway and tongue space, very, very important. And he picked up on it a century or more ago. I mean, the man was amazing. And all the research that he did without all the magical instrumentation that we have nowadays.
Amazing. I mean, and because of the work that he did, you can do what you do and expand on that as well.
Right.
Yeah.
Yes.
Yes. So what
Yes.
else do you have in your bag of tricks to talk to us about?
Don't let age deter you.
Mhm.
I say this every single time I can. I have an 84-year-old who's decided that it was time for her in her life. She kept being nudged by her family that she snored and she wasn't well. 84 years old. We've developed her arches. We've reduced the disc displacement in her jaw joints. We're bringing her vertical for her height between her teeth together. Her aches and pains are gone. I mean, it's fascinating to think that the box that we are told, it's like a playground. You're only told that you could. You remember Truman's World, the movie Truman's World, where all he
Oh
knew was
yeah.
what
Oh
he was
yeah.
in?
The
It's
Truman Show.
exactly
Yeah. Yeah.
right. That's right. It's exactly the same thing. We're told that we can only do so many things. And if you're an outside the box thinker, it's like, well, why? Well, why? Why are you on this medication? I don't know. My doctor told me I needed it, but why? And so think for yourself, be your best advocate. That would be my best advice to everybody is think. Ask questions, ask questions, ask questions. You fight. And that's what the Maha movement, for example, is all about. RFK Jr. was doing that because you had moms that went to all the school board meetings. I don't want my kid to be a pincushion. I don't want this. I don't want that. Why am I being told what to do? If your kid is vaccinated, why do you have to worry about my kid not being vaccinated? Because if the vaccines really worked, then your kid will be immune to what, just think about the idiosyncrasies there in that whole loaded question. Follow the money. Just follow the money. Figure out who's going to be best served by what you're recommended. And I would be the first one to say, I would do this if you were my daughter, me, or my child, or my sister. But at the same token, I don't think this is the best route of action for you. I would recommend here are your options. You pick the best one that you feel comfortable with. I think that's really important that we have freedom of choice. And that's what I tell patients who call that are very insurance driven. I don't say that we're a practice of and we don't do insurance, it could be harmful for your health. I say we're a freedom of choice. I'm not going to let insurance dictate the kind of care that we need. If you need to go ahead and have a procedure, I'm going to recommend that one for you. You decide if you want to do it, I'll help you. I'll figure out a different way to do it if you want, but we're going to get to the bottom of it to figure out why you have these issues. Anyhow, you can't arbitrarily say, do this, do that until you know why it went downhill anyhow. Then reverse engineer it afterwards, you see?
Absolutely. So because we're getting down to the final several minutes of our class today, and this has been really good. It's nice to see how it's all connected. But if you were to
Yeah.
say three foods that you need to avoid and three foods or things that you need to do to improve. So it's like three things to avoid and three things to improve our oral health. What would you say?
Um, Seed oils. I would
Okay.
avoid anything that's seed oils or that's not natural. I would avoid any chemicals that are added. So basically, watch your water. All right. And then I would say eat as clean as you can. So anything that is out there, in Europe, they actually don't have American products because they're so toxic. Europe has a food coloring or food additives, vegetables or fruits that actually have what the coloring to make their foods pretty, so to speak. In America, they use chemicals and bugs.
Okay, three things to add.
Lots of water, lots of water, lots of water. You can decide if you want to be vegetarian. You could decide if you want to be vegan. Some people live on air. Some people breathe on whatever. Everybody's different. You have to channel what is your superpower, what works for you. I mean, had one thing. I mean, I was a vegan for 20 years and I only ate, certain meats or certain fish or whatever. And I change all the time. Figure out what works for you and then get your tribe. Your vibe attracts your tribe. And I think the best food, let food be their medicine, but the best food is your spirituality. And I think that would be the perfect way to end this conversation. And that's one of the connections in the book that nobody would ever think that would talk about spirituality. There are thousands of references, the gnashing of teeth and things in the Bible about emotions and beauty and everything. But spirituality is huge. I think it's very important. That spirituality feed your soul. Because if you don't have a soul, you're not getting anywhere and you're not going to be happy. And you're going to be very materialistically oriented. The ego is going to take over and you're going to want what your neighbor has when it's not really what you want. But if you go within and you feed your soul food, feed your soul with what is right and what is just, God takes care of his creatures because we're all one.
Well, this has been beautiful. Thank you so much, Dr. Claire Stagg. For those of you who want to learn more about or go to her office or give a call, get a consult, she's at 2120 Highway A1A in Indian Harbor Beach, Florida. You can call it 321-777-2797, or you can go to healthconnectionsdentistry.com. Dr. Stagg, and get the book and make sure you write a review once you take a look
Please do.
and that'll help her quite a bit. And so,
It's
Dr.
it's a
Stagg,
message. It's a
yes.
message. And one of the things that the last little blurb in the book is you are not a drop in the ocean. You are the entire ocean in a drop.
Mm.
We're all part of the same movement. We're all part of it. Some more aware than others, but we're all one. It's all one creator, one source. It's one. The world is awakening to this, and I think the more that we actually get it out there, but we gotta go ahead and help the fellow man who's not quite there yet. And it'll come. It's coming. I wish it could go faster, but I mean, look what's
God's
happening
time.
nowadays,
Yes, God's
right?
time. And God's time is good enough. So thank you so much, Dr. Stagg. I've enjoyed all this time with you. I'm looking forward to possibly being part of the teaching of all these doctors that are out there that don't know what they don't know. And I'm sure that they
Right.
will become much wiser after taking one of your classes. So thank you so much for everything that you've shared and imparted. You can find those of you who are tuning in for the first time and meeting Dr. Stagg. You can go to my YouTube channel or any of my shows, but at least in the YouTube channel, we have a playlist that's for oral health. And of course, most of it is with Dr. Stagg. So thank you so much.
Thank
And
you.
thank you, Dr. Stagg. And all of you, please remember, we're here. We'll be here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
Ever.
Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.